I've got a medical background. I've spent many years working in medical wards in various positions. As part of that work, you would look after patients who would, through their disease process, become palliative. So I experienced looking after palliative patients then. And then I moved into oncology, and palliative care really goes hand in hand with oncology. And then 3.5 years ago, I was approached to do a shared role in a specialist palliative care unit, which is the role that I have at the moment, and that's where I intend to stay. The challenges of providing palliative care in regional and rural areas, as opposed to metropolitan, I think there's a few. One is being able to make sure you've got skilled staff or staff who can work in that area, and some people have to be a little bit older or have life experiences to do that. Making sure that we're all keeping up to date, so that we've all got the best education skills, and making sure that everything we do is what's the best at the moment. Sometimes you don't always have the access to the specialist, either allied health or medical staff, that you might have more in metropolitan areas. So that can sometimes be a bit of a challenge, to make sure that you're being able to refer on your patients to the appropriate sources as much as possible. The issues for me as a nurse are mainly, I think, at the end of each shift, being able to walk out the door knowing that the patients I've looked after have had the care and the comfort that they need, and doing that sometimes, some days are good, some days that can be a little bit more difficult and more trying. So keeping up to date, making sure that I'm got the education and the knowledge of what is currently best practice and best for patients, and probably encouraging fellow staff to also keep up to date. And probably, like any workforce in Australia, we've got a lot of staff that are probably due to retire, so making sure that we can get more skilled staff to work and carry on. Yeah. We are no different to a lot of other areas in Australia as far as finding it difficult to get nurses. There's a lot of young nurses do not want to work in palliative care, and I think back to probably when I was in my young 20s or mid-20s, it wasn't an area that I would consider that I would want to work in either. So, and I do think, talking to older nurses who've been in palliative care a long time, they do recognise that life experiences is good. So it is a challenge, I think, to be able to plan ahead and make sure that we're going to have the staff in the future. I just love Care Search, and I love it because when I went into the specialist area 3.5 years ago, one of the things I was very aware of is that in some ways I was the new kid on the block, even though I had over 20 years experience nursing, not specifically in a palliative care unit. So I felt a real pressure on me to make sure that I was keeping up to date, and that I had the resources and the knowledge to do that. And knowing that there is an online tool that you can access whenever, 24 hours a day, has just been brilliant. And so making sure all the staff, we have it on our desktop. I always get a newsletter through as well, which tells me what has been added to Care Search, so what's the latest policies or procedures or guidelines. And that's good, because then you can, particularly when you're developing policies and reviewing things, you can use that information to make sure that we're doing what everyone else in Australia is doing. And also, it gives you, sometimes when you work in a regional or rural area, there may be a feeling that you're not quite as good as the big metropolitan or other centres. And I think if staff know that they're doing things that are exactly the same that's being done everywhere else, and you're up to date, it helps with their morale as well.